Advanced care planning is about thinking ahead and talking about what matters most to you when it comes to healthcare. So your medical wishes are respected if and when you're unable to speak for yourself. An advance directive is a legal document that outlines your healthcare wishes if and when you're unable to speak, advocate, and make those healthcare decisions for yourself. And it lets you name someone you trust to make those decisions for you. It also allows you to document what matters most to you, what quality of life means to you, and what types of medical treatments you would or you would not want. You can designate more than one person listed in order to make healthcare decisions for you. It's important to note that only one person has authority at a time. That means a successor steps in if and when the primary person that you designated is unable or unavailable at the time to serve. POST stands for Physician Orders for Life-Sustaining Treatments. It can also be called most, or TPOP depending on your state, but the purpose is the same. A POST form is a medical order signed by a healthcare provider that translates your medical wishes into specific treatment instructions based on your current medical condition. POST forms are intended for people with serious illness, advanced diseases, or whose life expectancy is less than 6 months to a year. Unlike an advance directive, which guides future care, POST instructions or POST form applies to what should happen right now. It's important to note that POST forms complement advance directives. They do not replace or override them. Once completed by you and signed by a medical provider, a POST form should be easily accessible and shared with your healthcare provider and family. One of the biggest reasons to fill out advance directives is to prevent confusion and future conflict. You should note that every family is different. Some families have close relationships, some have complicated histories, and some have siblings who don't agree on much. If your wishes are not clearly documented, your loved ones may be left trying to guess what you would have wanted. And that can lead to disagreement, guilt, and tension at an already emotional time. Advance directives are really easy to fill out. It's filled out and signed by you, along with 2 adult witnesses who are not designated within the form. Or you can have it signed with a notary public. Let's give an example. You are a 65-year-old male. You designate your wife as your primary person, then your brother, then your sister as a third person. They will have full authority at a time, starting with your wife, brother, and then your sister. Then you will designate 2 adult witnesses who are not your wife, brother, and sister. Once completed and signed properly, the form is legally binding and valid, effective immediately.